Nate Jethro?
That's me.
Hi, my name's Charlotte Cahill. I'm going to be your student physical therapist today.
Nice to meet you.
Nice to meet you. So I understand that you have lung cancer.
I do.
Okay, and you're getting chemotherapy treatment.
Yes.
And I also understand that you have developed some chemotherapy-induced peripheral neuropathy in your feet.
Yep.
All right, so you're having some sensation problems.
That's right.
Okay. So a couple of things I want to talk about before we get started in the gym. So the first thing is, I also understand you've been having some fatigue problems, which is impairing your ability to do things throughout the day. Yep. So there's a couple of things that you can do during the day to try to reduce your fatigue. So the first thing is to make sure you take enough rest breaks. And resting means doing absolutely nothing, so sitting on your butt. It's also going to be important to help you not work all the way through and get totally fatigued, because you'll stop before you actually get fatigued, so it'll help you increase your endurance as well. It can also be good to plan ahead for your day, so maybe schedule your activities ahead of time and make sure that you spread them out throughout the day, alternating heavy and light activities. You can also pace your activity, so taking rest breaks even in the middle of doing something is totally okay. It's also important to understand your activity tolerance. So figuring out if you're doing an activity that's long or heavy, you can try to break it down into smaller activities in order to make sure that you can actually complete the task without getting fatigued. Setting priorities is also good. Do you feel like you have more energy when you first wake up or at night?
When I first wake up.
Okay, so it could be beneficial to plan larger activities for the morning so that you can actually get them done. You have more energy. So that's it for that. But it's really important to implement those in order to make sure that you have enough energy to get through your day. So as far as your chemotherapy-induced peripheral neuropathy, so basically what's going on with that is that your chemotherapy drugs are affecting your nerves negatively, impairing their function. And so you might feel pain, tingling and burning, numbness, weakness. Do you feel like you trip a lot or lose your balance?
Yeah.
Yeah. So the important thing to understand is that that might progress even up your legs, up your arms, and into your hands as well. So if you feel like any of that is happening, it's important to talk to your doctor. So the main things that you'll notice with your hands is that you might have trouble holding on to things. You might drop things a lot. So it's important to understand that that may happen, and that if it does, to talk to your doctor. Your doctor can prescribe drugs that sometimes help with the peripheral neuropathy. And also they may try to spread out your chemotherapy treatments, which has also been shown to help. So it's important to consider. And the last thing I want to talk about is a self-foot exam. So because you're having decreased sensation in your feet, it's important to check them every day for anything out of the ordinary. So it could be blisters, red spots, swelling, any skin cracks, or like broken toenails. So I'm actually going to have you do it right now. Take off your shoes and socks. So the bottom of your foot is a really important spot to look. Yep, and in between your toes. And if you feel like you can't get into that position, you can also put a mirror on the floor and look at your foot that way, or also ask a family member to help you out with that. So that was good. It's also important to wash your feet every day and make sure you dry them off really well. You can also use lotion on them to help with dry skin. And make sure that you're using proper footwear, so protective footwear. If your shoes are really old and worn out, it might not be good for your feet, so we may have to look into getting you some new protective footwear that you have to break in gently. Basically just has more padding and protects your foot better. And it's important not to walk around with bare feet because you might step on something and not be able to feel it. Along those lines, also before you put on your shoes, it's important to look in there and see if there's any foreign objects that you might need to take out before you walk around. And I think that's pretty much it. Do you have any questions? Was that pretty clear?
It was clear. Thank you.
All right, good.
Yes.
So let's go ahead on to the gym then.
All right, let's go.
Start our treatment.